Wisdom teeth are the third molars in your mouth. They usually erupt around the age of 18 to 25, and they are the farthest back teeth you have in your jaw. Problems and pain people have when wisdom teeth are erupting are inflammation around the gums, difficulty in keeping the area behind your second molars clean, sometimes some swelling or some bleeding. Wisdom teeth do not always need to be removed, but the majority of the time, the jaw of the lower jaw and the upper jaw does not have enough space to fit your wisdom teeth, so they become impacted or partially impacted, causing some infection issues and some problems with keeping those areas clean. An impacted wisdom tooth is a tooth which is underneath the jawbone and covered by the jawbone, so you wouldn't be able to see an impacted tooth in your mouth. So some of the main problems people have with retained wisdom teeth would be infections and irritation of the gum tissue in the back of the jaw, or difficulty with either bite or clenching. Well, wisdom teeth are difficult to remove because they're farther back in your jaw. There's more bone over top of the wisdom tooth than a regular tooth, and it is usually a larger tooth than another tooth in the mouth. The local anesthesia I give usually lasts between 1 to 2 hours after you're home from the procedure. Usually during a wisdom tooth removal, I recommend for my patients to be sedated. It's a better experience and less that you have to remember. So at our office, the sedation is administered by myself and a registered certified nurse anesthetist. We administer almost all the anesthesia through IV access. Usually recovery for wisdom tooth extraction is around a 3 to 5 day course. The third day is usually the worst day for pain and swelling after wisdom tooth extraction, and around the 5th to 7th day you start feeling back to normal again. So for post-op pain medication, I recommend a non-narcotic course, which would be Motrin 600 milligrams, and then Tylenol 3 hours later, and then Motrin again. I try to avoid narcotics in my practice. They can promote nausea, and we don't want to have nausea for wisdom tooth recovery. There will be stitches where your wisdom teeth are removed. The stitches dissolve on their own in 1 to 2 days. So dry sockets are an exposed bone in the extraction site, and they can be very, very painful. We usually see them around the 3rd to 5th post-operative day. To prevent a dry socket, we want to keep the blood clot in the extraction socket as long as possible. So that means no using straws, no spitting, and no smoking. You definitely want to brush your teeth. That's probably the most important post-operative instruction. We want to start routine brushing the next day after the surgery, and even gentle brushing right on the extraction site. After wisdom tooth procedure, some good food to start eating would be applesauce, Jell-O, Italian ice. You want to stay away from dairy products that first day that can get you nauseous, and anything that's soft. Try to avoid sharp foods that can get stuck in the extraction site. I recommend for my patients to wait 5 days after wisdom tooth removal. We don't want to get your heart rate or blood pressure elevated. That can promote swelling. So for a follow-up after wisdom tooth procedure, I see all my patients at the 2-week follow-up period, and then after that point, you'd be free for routine dental care.